Good afternoon. Thank you very much for joining us here on Facebook today. You are watching Ask Us Anything About Midwifery. I'm Barbara Shindo. So for people considering getting pregnant, wondering about childbirth, having questions about the process, a midwife is something that is an excellent option for a lot of people. But the decision to use a midwife can often come with a lot of questions, a lot of confusion, some misconceptions about what a midwife does. So we are here today to talk about midwifery, and joining us today is Angela Klock, who is a certified nurse midwife at Penn State Health, Milton S. Hershey Medical Center. Angela is here to answer some questions, and we welcome your questions for Angela. If you have a question about midwives and what they do, please feel free to post your question in the comment field below this post here, and we will get an answer for you. And that the questions will work whether you're watching this live or if you're watching this on playback. So Angela, thank you so much for joining us this afternoon.
Hello, glad to be here.
So let's start with a basic question. Tell us, what is a midwife? What does a midwife do?
So a midwife is a registered nurse who has additional education. Since the year 2010, it requires a minimum a master's degree in nursing to be able to hold a midwife license. So we have about 2 to 3 extra years of education beyond our nursing education to be able to hold this degree and this credential. A midwife takes care of women of all ages, from puberty and teenage years all the way through menopause. We can take care of all of their women's health, reproductive needs. We can function as a primary care provider too in a lot of settings.
Okay, thank you. Talk a little bit about what's the relationship between a patient and a midwife like?
Well, it's really meant to be a team-based approach. We are meant to be a partner in their healthcare arena as far as their women's health needs are concerned. So we kind of look at it as though we're all on a team, and we don't really make decisions for the patient. We help them explore their options so they can come to a decision that is safe for them, and that is something that they desire to do or follow through with. And we're just there as a resource a lot of the time.
Okay. So for somebody who's thinking about a midwife, who's thinking about who might already be pregnant or is thinking about getting pregnant, what do you think is the big, important message for them to know?
First and foremost, I would have to say to try and get your chronic conditions managed, to try and be at an ideal weight, to eat healthy, exercise. I know it's a tough time right now that everybody's going through with so many changes that can limit some things, but those would be the first things. And then to seek out a provider that you are comfortable with. That's the main thing. Whether it's a midwife or physician or another advanced practice nurse, to see for your OB care, it doesn't matter. You just really need to feel comfortable and make sure that that person is the appropriate person taking care of you, whether you're low risk or high risk. And you can always come see us, and we can always point you in the right direction as to get you the right care that's appropriate for your needs.
Okay, so we will get to in a few minutes. I have a few more questions about what might be considered some of the misconceptions about midwives. But before we get to that, kind of more into that, tell me a little bit about, do midwives work together with physicians as part of a team based of care, or how does that work? Like, what should the patient know about working with a midwife and a physician?
So there are some different scenarios, but midwives typically have a collaborative physician that they work with that's available to help them either co-manage or transfer the patient if a higher risk need arises that's beyond the midwife's scope of practice. Here at Penn State Hershey, we have a team in labor and delivery that consists of physicians and midwives, and we work together. The midwife can completely manage the lower risk, healthy, full-term pregnancies and deliveries. If something comes up that we need to co-manage with some physician advice or involvement, we can certainly do that. A lot of times with the midwife still being able to provide the majority or most of the care, but having some physician input. And in the event that things, become much higher risk or need care beyond our scope of practice, the physicians are right here. It's a seamless transition. And a lot of times we can still be involved. We're just not the ones making the medical decisions for management, especially of the higher risk or chronic conditions.
Okay, you are watching Ask Us Anything About Midwifery. I am here with Angela Klock, who is a certified nurse midwife at Penn State Health, Milton S. Hershey Medical Center. Angela is happy to answer your questions here on Facebook, whether you're watching live or on playback. If you have a question for Angela, please post it in the comment field below this post, and we will get an answer for you. So one of the things we had already mentioned, and we had talked about before we started doing this live, is there's a lot of things about midwives that I didn't know, and I think that maybe the general public doesn't know, and I think there are also a lot of misconceptions. So let's start with one that I think is a really common misconception about midwives, and that's that midwives and doulas are the same thing. Can you talk about are they the same thing, and if not, what's the difference?
I think we can provide some of the same care, but there is a difference in level of education and scope of practice. So a doula is a birth partner. It is a support person that some women do employ for their labor experience. Often they will meet with them a handful of times or so, depending on the doula's practice. They'll meet with them prior to delivery and kind of get a plan together, and then the doula can accompany them typically to the hospital and provide labor support, massages and distraction techniques, relaxation techniques, just coaching and verbal support, moral support, things to help them relax and manage the discomfort during labor and birth. They typically will have either like an apprenticeship or some maybe online certification kind of information that they'll go through. The difference with the midwife is that we can be your labor and delivery provider. So we can order your medications that you need, your lab work that you need when you're here in labor and deliver the baby. We can care for you postpartum all the way up through discharge. So we have kind of a broader scope, and we can, handle things that come up that need medical attention that a doula wouldn't be having in her scope.
Okay, thank you very much for that. So we do have a couple of viewer questions coming in now. So we will start with a question from Vanessa. And Vanessa is asking, what does a midwife provide for, I think it means for the patient here. What does a midwife provide for the patient? How often will we need or meet? Or, how often would you see a patient?
Sure. So there are some general guidelines as far as frequency of prenatal care for pregnancies, and the general guideline is about once a month through the first 7 months, and then every 2 to 3 weeks or so until the last month of pregnancy, and then typically in the last month of pregnancy, ladies are seen weekly until they deliver. That can be more or less depending on things that are going on with that particular pregnancy, as far as it developing and progressing low risk or higher risk. And then during the labor and delivery process, we're there to help support them through the labor. We can provide, one-on-one comfort measures, help reposition, find positions for labor and birth that are going to help her not only feel comfortable, but hopefully keep the labor progressing as smoothly as possible. And, if someone wants to choose pain medication, we can talk about that and institute that at some point if that's a desire, all the way through the delivery process. So we're in and out of the room as frequently as we need to be, more if the woman it wants. We also respectfully will give her private quiet time and not just be in there, distracting her from the work she's doing during the labor.
Sure. So it sounds like, you get to know each other, pretty well. Like you have a good relationship
very well.
Before, during, after
Yeah.
during pregnancy, after childbirth. So That's a lot of great
And we'll
information.
see them back in the clinic postpartum as well for their
Mhm.
postpartum needs. And then, they can elect to come to us for their annual exams before and after. So it really can be a lifelong relationship.
I appreciate that, and I'm sure Vanessa also appreciates that. And as Vanessa, we appreciate your questions as well. And I know Vanessa has another one here that I'm going to ask. And Vanessa wants to know, as a midwife, what are your expectations for the mom? Like, how do you, what should she know about you going in, and what would you expect to relationship?
Going in, I think, is just, feeling free to ask any questions at any point along the way, to know that we're there to listen and to answer and provide resources. If there's something that we need to help her get connected with that's beyond our initial scope of practice, we certainly can do that. And just kind of being open to suggestions and thoughts and the team approach. Other than that, it's really just being present, taking charge of their own bodies and their own prenatal care, and coming to their appointments so that they and their babies can be as healthy as can be.
So moms are just as involved in, the decision making and the process and what they want and what, what kind of birth experience they desire. Just be open about it, talk to them
Some ladies will develop a birth plan ahead of time. Many don't. Many, it's an evolving process as things happen. Midwives are really good at listening to patients and being a team supporter, just kind of working together. So I think that's the most important thing.
You are watching Ask Us Anything About Midwifery with Angela Klock, who is a certified nurse midwife at Penn State Health, Milton Assertion Medical Center. We welcome your questions for Angela, whether you're watching live or on playback. If you have a question, you can put it in the comment field below this post, and we will get an answer for you. Now, Angela, you had already addressed a few of these things in some of your answers, as we were talking a little bit about misconceptions and some of your other answers here. But I think it's kind of important to just hone in on some of these things, because one of the things you had mentioned, which surprised me, is that midwives aren't only involved in pregnancy and birth, right? That's kind of a misconception, that a midwife is just here to help you through your pregnancy and through childbirth, but that's not true, right?
Correct. Yes, we can. We do birth control counseling. Some of us have experience and are certified to place Nexplanon implants and remove them for birth control, place and remove IUDs for birth control or bleeding purposes. We can do annual exams and pap smears. We can assist with breastfeeding and breastfeeding education, prenatal education. Some of us even have some advanced certifications to perform even assist physicians in the OR if you would need to have a C-section.
Thank you. That, and like I said, that I'm so glad to be having this conversation with you and learning about this, because I didn't know that, and I think that's so helpful to know, and that's such kind of a just another option for women, or for for people who need this kind of care, to help to them. So very much appreciate you letting us know about that.
Sure.
So another common misconception I had wanted to ask you about is, I think when people picture a midwife in their head, they're picturing, home birth only. They're picturing a completely natural birth. But that's not what you do, is it?
No, the latest statistic I've heard is about 90% of the midwives in the U.S. do deliver, the certified nurse midwives, I have to be specific, do deliver in a hospital or birth center setting. There are different levels of midwives, but you're specifically asking about the certified nurse midwife. So there are some lay midwives and some certified midwives of varying abilities depending on which state you're in. But the vast majority of us are certified nurse midwives. There's a little over 13,000 of us right now in the U.S.
Okay, and one other misconception I wanted to ask you about that I had read about is that somebody who might have a chronic health condition or who might be considered a high risk pregnancy shouldn't see a midwife. But you are well prepared to care for those types of patients as well, correct?
Sure. Yeah, absolutely. And sometimes there are very high risk pregnancies where we're not as involved, and we can certainly care for the women before and after pregnancy for their annual visits. But many chronic conditions, such as blood pressure issues or diabetes management, we can certainly at minimum co-manage with our physician counterparts. We each have our own areas of expertise, so we certainly can do the prenatal care. We can still assist them in labor and delivery, and often do, just with some input and co-management with our physician counterparts. So that's where that team approach really comes into play, so that we can each kind of practice to our level of expertise and make sure that the mama and baby gets the best care that they can.
Okay. Are there any other, misconceptions or beliefs about midwives that you think are wrong that I have not asked you about?
The only thing sometimes people are not aware that we are independent prescribers, so we can prescribe your birth control and other medications if there's oftentimes women get yeast infections or other vaginal infections, and we can certainly diagnose and treat those, prescribe, monitor, those kinds of things. So you don't have to go to someone else to get your prescriptions if you need them.
You have been so informative today. I feel like I have learned so much during this. And I've hosted a whole bunch of these, which are always enjoyable, and I always feel like I learn a lot. But I feel like I was one of those people who had these misconceptions and didn't know all these things about midwives and midwifery. To be honest, I wasn't even sure before that I was pronouncing that word correctly, but that helped me with the midwifery word. So thank you so much for joining us here today to talk about this. I think it's been very informative. And for anybody who is watching this on playback, we still will have an opportunity to get you some answers to questions. So if you are watching this on playback and you have a question for Angela, just put it in the comment field and we will follow up with you. But Angela, thank you so much for joining us today, and thank you for watching. Ask anything about, oh wait, yes. I'm speaking too soon. We have one more question. We have one more question coming in. So our last question here is from Vanessa, and she wants to know the question on everyone's minds. This is a good question. Is midwifery available via insurance?
Absolutely. We are credentialed through the majority of insurance companies. So if you have a question about a specific policy, you may want to check with your insurance company first, but we are considered primary OBGYN providers. So I myself am credentialed through more insurance companies than I can even count. So typically when you're hired, they get as many as they can. Sometimes someone moving into this area for the first time that may have an outside insurance that's a little bit different from what we see typically around the Pennsylvania area, you may just want to check with your insurance. But the overwhelming majority of insurances will reimburse for midwifery care. So you do have that choice.
That is very good news, I'm sure. Thank you so much. And again, Angela, thank you for joining us. Thank you for all this informative discussion today. It's been really fun. So I appreciate your time. And for those of you watching, thank you so much for tuning in to Ask Us Anything About Midwifery.